Hello everyone and welcome to our video presentation. In this video, our group will be present on a case study that was taken during our practicum in pediatric ward. So this is our group member, consists of 5 persons. So this is our outline presentation, include introduction, pathophysiology, signs and symptoms, assessment, medical management, pharmacology management, nursing care plan, health education and conclusion. So for the general introduction, these are the cases that have been presented into the pediatric ward during this week. So the common cases that we see in newborns such as intrauterine growth retardation with low birth weight and neonatal jaundice. And the other cases include acute gastroenteritis, upper tract infection, and the list of respiratory distress such as acute exacerbation bronchial asthma, acute bronchiolitis, viral-induced wheeze, and multi-trigger wheeze. So this is the case study of a child A. She is female, a 6-month-old. She is Malay and Islam. She has not known drug allergy and not known food allergy. She was admitted to the pediatric ward on 21st March 2021, and the reason for current admission is pertussis latinus and eczema. She was referred by ETD, and during the admission, she was carried by her mother, and her current weight was 6.54 kilogram.
For the part of the pathophysiology, bronchial inflammation with airway constriction and resistance cause the bronchospasm, edema from microvascular leakage, and this cause narrowing of the airway. From that, airway capillaries may dilate and leak. This will increasing the secretion, which then causes edema and impair mucus clearance. And then, plaques of the thick mucus can block the airway. For signs and symptoms that present in this patient, the first one is the running nose, low-grade fever, paroxysmal coughing, which is involve frequent coughing that can make it hard for person to breathe, rapid breathing and audible wheeze, chest recession, difficulty in sleeping.
Assessment for child A was taken. Her vital signs progress was taken on 3 parts, which are in ETD, during interview, and upon discharge. On the 21st of March in ETD, her temperature was 38 degrees Celsius, which is considered high for a child. Heart rate is 150 to 160 beat per minute, and respiratory rate is 48 to 52 breaths per minute, which is considered tachypneic. And her oxygen saturation is 91% when she was under room air, and 98 to 99% when she was given oxygen 2 liters per minute. During interview on 26th of March, her temperature was 37.5 degrees Celsius, which is a low-grade fever, and her heart rate was ranging around 138 to 142 beats per minute, and her respiratory rate is 38 to 40 breath per minute. Her oxygen saturation was 97 to 98 when she was on trial of oxygen. And upon discharge on 29th of March, her temperature was 36.4 degrees Celsius with a heart rate of around 128 to 130 beats per minute, and respiratory rate is 24 to 30 breaths per minute. And her oxygen saturation is 99 to 100 under room air. So on 29th of March, upon discharge, her vital signs are more stable compared to during interview and in ETD. So for physical assessment for child A, it was taken on 26th of March 2021. For her general appearance, she was more active and less cranky when compared to the past few days, and she had pink appearance. She was tolerating orally, and the mother claimed that child slept adequately. She was given milk on demand, and it was a mixed feeding, and she was still having paroxysmal cough but able to sleep overnight. She had low grade fever with 37.5 degrees Celsius, and her weight at the time was 6.54 kilograms. Her head have few hairs and clean and no rashes or dandruff seen. Her eyes, ears, nose, and mouth are clean and no visible discharge. No milk rash or cracked lips seen. She had an already dry eczema scars seen on the pinna of her left ear. The child coughed up mucus when coughing. So for her upper limb, her skin and nails are clean and short, and she had no cyanosis or clubbing fingers. She had a very good perfusion, and she had less than 2 seconds of capillary refill. Next, for her neck and chest, it was seen dry eczema scars on her neck, but no other rashes or other skin conditions on the chest. She was a bit tachypneic, evidenced by the suprasternal recession, but she had good air entry. She had prolonged expiratory phase, but no rhonchi or murmur heard upon auscultation. Her abdomen had a soft abdomen and non-distended. On her lower limb, she had a very strong reflex, and she had a clean skin, but an old eczema scars are seen on both foot. Her two nails are clean and short, and she had good perfusion. She, she had a capillary refill less than 2 seconds. She was yet to able to walk or stand on her 2 feet when whole. For her genitalia, she had a very good bowel movement and no diaper rash are seen. Her passing, she passed urine on a fair amount, and no discharge are seen, and it was clean. Her progress for medical management was taken during 3 parts, which were in ETD, upon interview, and upon discharge. In ETD, she was given oxygen 2 liters per minute, and nebulizer VN was given every 4 hourly. And she also given IV drip NSD5 40 mils every hourly. And she was given syrup PCM 95 milligram because she was having fever at the time, which was 38 degrees Celsius. Upon interview, she was given syrup EES and nebulizer VN also every 4 hourly. But at this time, she had a trial of oxygen, and PCM was not given because her temperature at the time was only 37.5, and PCM was only given when her temperature was 38 degrees Celsius and above. And she also given aqueous cream for her eczema and to be applied after every shower. Upon discharge, she was to continue syrup EES 120 milligram for a total of 2 weeks. And she also given syrup salbutamol 0.05 milligram every 3 hourly for 3 days. And she also allowed discharge in the evening and to come again in 1 week to pediatric clinic to be reviewed by the doctor. For the pharmacological treatment, the infant have been given syrup erythromycin ethyl succinate The dosage is 120 mg and the frequency is 2 times per day. The function of this medication is to treat a variety of bacterial infections. The side effects are sore throat, difficulty breathing, vomiting, and fever. For the nursing consideration, first, we have to shake the medication bottle before use. Second, ensure the dosage is correct before giving to the patient. And third, assess for any side effects after administering the medication. Next, the infant have been given syrup paracetamol. The dosage is 95 mg and the frequency is PRN. The function of this medication is to treat fever and relieve mild to moderate pain. The side effects of paracetamol are rarely happen, but skin rashes and hypersensitivity reaction might occur occasionally. For the nursing consideration, first, we have to assess infant's condition, which include the body temperature, heart rate, and respiratory rate. Second, shake the medication bottle before use. Ensure the dosage is correct according to infant's body weight, and assess for any side effects after medication is given. The last medication that have been given through nebulizer is Ventolin. The class of this medication is bronchodilator or anti-asthmatic. The function of this medication is to loosen the mucus and act as a selection beta stimulation of receptors in respiratory smooth muscle producing bronchodilation. The side effects of this medication are tachycardia, nausea, vomiting, and increase in breathing. For the nursing consideration, we have to ensure the amount and dosage of the medication is correct according to the child age. And then we have to place the infant in the upright position or elevate the head of bed. We have to assess for the side effects of the medication. And last, we have to evaluate therapeutic response, which is the ability to breathe adequately.
Okay, next is nursing care plan. This nursing care plan was done during her admission to the ward. The first nursing diagnosis is ineffective airway clearance related to the secretion at the airway as evidenced by nasal discharge and cough up of mucus. Second, ineffective breathing patterns related to the secretion of the mucus at the airway as evidenced by the respiratory rate 40 to 42 breaths per minute. Third, hypothermia related to the infection at the respiratory tract as evidenced by 38 degrees Celsius of the temperature. Fourth, impaired skin integrity related to the placing of the nasal prong as evidenced by eczema around the child's neck and left pinna. In this case study, we will explain more detail about the first two nursing diagnoses from this list. And for the goal of the first nursing diagnosis is, the child will not have nasal discharge and cough up of mucus anymore. For the interventions, first, administer nasal prong 1 liter per minute as ordered by the doctor. This is to help the child breathe more effectively. Second, administer nebulizer as ordered by the doctor in order to help the releasing of the airway muscles. And then the third one is advise mother to wipe up the nasal discharge of the child frequently. This is to help the removal of the secretion from the nasal. The fourth one is encourage the mother to give water to the child to keep the mucus thin, and it will be easy for the child to cough up it. And then the last one is noted the amount and the color of the nasal discharge and the mucus. This is to determine any improvement for further interventions. And for the evaluations, the child does not have any nasal discharge and cough up of mucus anymore. The second nursing diagnosis is ineffective breathing pattern related to secretion of the mucus at the airway as evidenced by respiratory rate 40 to 42 breaths per minute. And the goal is the child respiratory rate will back to the normal range, which is 20 to 40 breaths per minute. For the nursing intervention, first, assess the child vital sign, especially the respiratory rate 4 hourly. This is to determine the condition of the child's body. Second, administer nasal prong 1 liter per minute as ordered by the doctor. This is to help the child breathe more effectively. Third, administer nebulizer as ordered by the doctor. This is to improve the patency of the airway. Fourth, encourage the mother to sitting the child. This is to help the expansion of the lung. The last one is encourage the mother to feed the child. This is to restore the child energy. For the evaluations, the child respiratory rate back to the normal range.
Health education is about early symptoms that need to bring the child to the nearest hospital. First, educate the parents to bring the child if she or he has difficulty in breathing and hear for breathing sounds whether it low pitch or high pitch. And then bring the child to the hospital if there is increase in breathing, reduced oral intake, abnormal in urine output and bowel pattern, and having high fever and not resolved after taking the medication. The second health education is about nutrition guide for the infant. Firstly, encourage the mother to breastfeed her child frequently because it is a great source of nutrition for baby growth and development. And then choose infant formula that is suitable according to the child age if not breastfeeding. And lastly, introduce the child with foods that is soft diet other than breast milk and infant formula such as porridge, oats, fruit puree and vegetable mash. And then they have to give 3 times per day if the child is consuming breast milk and 5 times per day if the child is consuming infant formula. The last health education is regarding child immunization. First, ensure the immunization status is up to date. Second, follow the appointment date given by the healthcare provider. And lastly, ask the healthcare provider about the vaccines and that your child needs and its functions.
As the conclusion or the summary of this video, the patient has been diagnosed with pertussis-like illness and eczema during hospitalization, so the main concern of this child illness is to maintain the SpO2 level more than 95 and maintain the airway pattern. So we have prioritized the 3 nursing care plan, which includes ineffective airway clearance, ineffective breathing pattern, and impaired skin integrity. So the medical treatment that has been received by the patient include nebulizer, which is atrovent and Ventolin, nasal pro-oxygen, and oral medication such as syrup, erythromycin etosucinate, and syrup paracetamol. So currently, the patient condition has been improved as she complies with each treatment, which allow her to be discharged. So these are the list of the procedure that has been done in pediatric ward during this week, such as baby bathing, administer nebulizer, administer oral and intravenous medication, wagging and height taking, perform venipuncture, admission and discharge, and also observe intubation. So since intubation is a rare procedure in pediatric ward, so our group has been involved in preparation for the intubation, such as bed making, switch on the warmer, prepare the suction machine, prepare the oxygen tank, prepare the emergency trolley, and also lay out the preparation for the intubation, such as connect and choose the correct size for laryngoscope, and also choose the correct size for endotracheal tube. That's all from us. Thank you.